What are deep tendon reflexes and Ms. Spasticity? Imagine your body has a built-in system that automatically responds when a muscle is suddenly stretched. These are called deep tendon reflexes, or DTRs. When a doctor taps a tendon with a reflex hammer, it causes a quick stretch in the muscle. This stretch sends a signal to the spinal cord, which then sends a message back to the muscle to contract. This process happens very fast and automatically, without you thinking about it. In people with multiple sclerosis, or MIS, this reflex process often becomes exaggerated. This condition is known as hyperreflexia. MIS damages the upper motor neurons, which are nerve pathways in the brain and spinal cord that normally help control and inhibit reflex responses. When these pathways are damaged, they can't regulate reflexes properly. As a result, the reflexes become more intense, brisk, and sometimes even uncontrollable. This increased reflex activity is a key feature of spasticity, which is common in MIS. Spasticity involves increased muscle tone, stiffness, spasms, and sometimes rhythmic contractions called clonus. When a clinician tests deep tendon reflexes in someone with MIS, they often find that the reflex response is stronger and faster than in a person without MIS. For example, when the knee-jerk reflex is tested, the leg might kick out more forcefully and quickly. Research shows that in MIS patients with spasticity, the threshold for triggering these reflexes is lower. This means it takes less of a tap to cause a reflex response, and the response itself is more vigorous. This hyperexcitability occurs because the nerve cells involved become more easily activated, recruiting more muscle fibers during the reflex. Even though muscle weakness can be present in MIS, the reflexes tend to be exaggerated. Assessing deep tendon reflexes is an important part of diagnosing and understanding the severity of spasticity in MIS. Usually, the patellar or knee-jerk reflex is tested. The patient is asked to relax, and the examiner taps the tendon just below the kneecap. If the reflex is hyperactive, the leg will kick out more forcefully than normal. Managing hyperreflexia and spasticity involves medications like baclofen, tizanidine, or diazepam, which help relax muscles. Physical therapy focusing on stretching and range of motion exercises can also reduce stiffness and spasms. In severe cases, advanced treatments such as intrathecal baclofen pumps or surgery might be considered to improve function and quality of life. In summary, deep tendon reflexes in MIS spasticity are abnormally increased responses caused by damage to the central nervous system. These exaggerated reflexes contribute to muscle stiffness and spasms, which are hallmark signs of spasticity. Understanding and measuring these reflexes help healthcare providers diagnose and tailor treatment plans for people living with MIS. Always consult with a healthcare professional for personalized advice and management options.